Thank you
Good
everyone
morning.
for joining. Thanks everyone for joining us today. We have John with National General on the line. He's actually going to help us with the webinar today.
Well, good morning, everybody. I really do appreciate you guys taking time on a Friday to go through some of our plans, the new quoting site. Obviously, there's a lot of moving pieces right now, not only within our company and our quoting site, but then, we will definitely want to point out our short-term medical plans and the designs and the rules that are changing or the laws that are changing as of October 2nd. So what I want to do is kind of incorporate everything within our new quoting site. And that's going to be where we can look at the details of the plans, but more importantly, make sure that everybody who is contracted with us has registered for the quoting site. So you should be able to see my screen. And if you are already contracted with us and you go back to your original quoting link that you received, it will reroute you to this page. Now, what it's going to do is it's going to ask for your national producer number and your last name, and then it'll tell you that it found you within our system, that you're contracted. What it's going to do is then it's going to take you to another page, and it's going to ask you to create a user ID and a password. So I'm going to skip this part and actually go to the login screen. As far as the login goes, just to create user ID and password, most people are just using their email address because it's easier to remember. Passwords have to be at least 8 characters, and then they can only be uppercase, lowercase letters, and numbers. So you can't use any special characters. So we just want to make sure that you're creating a username and password and obviously hanging on to that for future times when you need to get into our new quoting site. But I'm just going to use our test account for this morning and log in. So in our new quoting site, when you actually get to your home page, this is where you're going to start. And so I'm going to show you the easiest way to get through running a quote. Then the really nice thing about the new database that we're using, or the new quoting platform, is that it does work as a database. So you can save your client's information in there. So if you're running a quote for Mr. and Mrs. Smith and their family, it will save their zip code, it will save their dates of birth, it will save their address. That way, 6 months from now or whenever the time might be, you need to run another quote, you don't have to dig up all that old information. It'll store it in our system. But what we'll do is we'll get in and we'll run a dummy quote, and we'll get you to look at the actual plans themselves. So I'm just going to plug in a zip code, and then it's going to take us to our census page. Now, if you do have a zip code that crosses a few different counties, it's going to ask you to specify which one it is. We'll just leave it at Dallas County. Some of you may already know this, but we can do child-only coverage for our short-term medical plans. So if there is that case, you want to check this box, and then you just want to put the child's date of birth within the census. The only restriction we have on that is that the child has to be at least 2 months old. So 2 months to 18 years old, we can do a child-only policy. But for right now, what we're going to do is just run a dummy quote. If you do have a client that is a tobacco user, you would check this box, and then a calendar will pop up. That calendar is just asking for the last date that they use tobacco. Good thing is we don't have tobacco or smoker rates for our short-term medical plans. That really only pertains to our cancer, heart attack, and stroke, and our critical illness type policies. So non-smoker, smoker, doesn't matter for our short-term medical plans. So another thing coming up is our term. And real quick, we'll go to the start coverage date, because you can have the coverage start as soon as the next day. In case somebody is in a pinch and they need coverage starting tomorrow, we can do that. Now, one thing that we're looking at right now, for those of you who have run quotes with us, we can do 4 consecutive 3-month policies. On October 2nd, I know the majority of the business that you guys write is in Texas. We're going to be able to start running plans for 12 months. Technically, it's 364 days according to the new guideline, but on October 2nd, you're going to be able to run quotes for our 12-month plans. The other key piece in this is if you have any clients who already committed to our 4 back-to-back policies, starting on October 2nd, we're going to start migrating those. And what I mean by that is if somebody is in this continuous process of plans, whichever plan they're in, whether it's their first, second, or third plan, we'll extend that to the last day where their fourth plan would have expired. So what that does is it's locking in their premium and they don't have a resetting deductible. So we will automatically do the migration of those plans. Now, you may have some clients where they've got that back-to-back setup and they're going to run past the new year. If it were me and if it were my client, more than likely I would be canceling their policy, at the end of the year and writing them a fresh policy for January 1 to get them from open enrollment to open enrollment, just to make sure it's easier on the client and they don't have coverage running out in the middle of the year, and the possibility to have to requalify, especially if there are some health conditions that came up and they may not be able to qualify. So like I said, October 2nd, that's the key date to keep in mind, because we're not going to have to worry about the consecutive terms. We're going to be able to do something up to 12 months at that time. But for right now, we'll just leave it at the default. And there is a payment option for single pay. One thing to keep in mind, if you are doing a single payment, you can only write a plan up to 89 days at one time. We don't have a whole lot of clients who are looking to do that because a lot of them just can't afford, the amount for multiple payments at once. But for right now, we'll just default, leave it at monthly payment, and we'll get into looking at the plans themselves. Now, the key piece when this next screen comes up is for people who don't do a ton of work with us and don't go into our quoting site all that often, we've got something designed for each particular state, the most common bundle that's being sold to clients. And I don't know why we've got a delay here, but it should be getting to our next page in just a second here. But while that's loading, like I said, what we did is we took the guesswork out. So it's going to put together a package for you. It's going to have a short-term medical plan and a dental plan, and then probably something with accident coverage and hospital coverage, cancer coverage, just to make sure that the clients are covered on the front end with a health plan, but also covered on the back end, something that's going to help them with their deductible and their out-of-pocket expenses. So we already did that pre-package, and we named it per state. So when this next screen pops up, it should show the Texas package. But we're going to bypass that, and it just came up. So real quick to look at this, within our Texas package, there we go. What we want to look at is it came up with a short-term medical plan. I need to send this call to voicemail. I apologize. Okay. So what we're going to do is we've got our short-term medical plan, we've got a dental plan, and then there's an accident piece that has accident coverage with our sickness inpatient rider. So SIP is sickness inpatient, meaning that if the client is hospitalized for at least 24 hours, they're going to get this full benefit amount of $7,150. So they spend one night in the hospital for the flu, for pneumonia, for appendicitis. We're going to cut a check for that full amount to the client. So we've got these pre-bundled packages. If that works for you and it takes the guesswork out, you can send the proposal to the client, or if you're on the phone with them, you can do the enrollment right away. But for now, we're going to bypass this because I want to show you where you can look at the details of all the plans. So we're going to click this button that says See All Plans, and this went a lot faster. Good. So when we get to our short-term medical plans, and we're going to start with this tab, we're going to scroll down. You're going to see the different options that we have. So we've got our different deductibles and co-insurance options, and couple things to touch on when it comes to these particular plans. So I want to look into the actual benefits. So we'll open up the brochure. In order to access the brochure, all you have to do is click on one of the short-term medical plans. It's going to take us to a plan benefits or plan details page. That's going to outline the particular plan that you clicked on. But we've got an easy way to view the benefits of all of these plans. So we're going to scroll down. And when you click on this link that says Plan Benefits, that's going to open up our brochure. Okay. So, looking at the specific details itself, one key thing to point out, if you guys didn't already know this, we contract with Aetna, and we utilize their Open Choice PPO network. So you have nationwide coverage within this particular plan. I know that's a key piece in Texas, seeing that the ACA carriers have gone to the way of HMO. Key point: I had an agent call just earlier this week, and she said her daughter is going to college in Maryland, and the health insurance plan they have in Texas won't cover her out of state. So she's going to put her daughter on one of these particular plans because it'll cover her in Maryland, it'll cover her in Texas, it'll cover if she's traveling wherever it might be. So you have this huge network that's backing our plans. A couple other things to point out in our plan highlights. Within all of our short-term medical plans, this first highlight here, telemedicine service. So it's a 24-hour access over the phone or web chat where clients have access to talk to a doctor or a nurse practitioner, and they can get a diagnosis over the phone. I mean, that's a key piece because there's no copay, there's no consultation fee that they have to pay. So it's a free service. The only thing that they would have to pay for is a prescription if that particular doctor ordered a prescription. That comes with all of our short-term plans. The next point are doctor's visits. If it's a regularly scheduled doctor's visit, hopefully it's somebody who's in network and they get the network pricing, but whatever they pay is subject to their deductible and their coinsurance. Now, another key piece, obviously we've got our telemedicine service, which doesn't cost anything, but the next best thing that we have there is our urgent care benefit. And the way that works is, as it says, the client pays $50 per visit. So you walk into urgent care, you pay $50 up front. And then it says, we waive your deductible. So it doesn't matter if you've got a $1,000 deductible or a $25,000 deductible, that's completely off the table. And then it says remaining expenses apply to your coinsurance. So if you have an 80-20 plan, you're only going to pay 20% of those remaining costs that are left over. And then we'll go back to the quoting site, but you'll notice that there are a few of our plans that have 100% coinsurance. Well, technically that means the client goes in, they pay $50 for their urgent care visit, and we take care of 100% of the costs on the back end. So, for simplified explanations, looking at that 100% plan, technically you're looking at an urgent care, a $50 copay in a sense. So definitely keep that in mind because people are going to wonder, urgent care is getting so expensive. By me, the last time I went into urgent care, it was over $300 just for a sinus infection. So if I could get in and out for $50 and then 20% of the costs or nothing after that, that's definitely a key feature within the designs of our plans. So just definitely keep that in mind. I'm going to go down the line here on our brochure because I want to look at a few differences within our plans. Now, you'll notice you can look at all the deductibles and you can look at all the different coinsurance options like I mentioned. There's a couple. Our $5,000 and our $2,500 deductibles have the 100% coinsurance option. The other thing to point out is if you do have a client, because of budget restrictions or something that comes into play, and they have to go with the 50/50 coinsurance, you'll notice that their coverage per period or per plan is reduced to $250,000. So the majority of the agents that are writing business with us stick with the 80-20 plans or the 100% because they want to make sure that their clients have that $1 million in coverage versus the $250,000. But like I said, I know that there's going to be budget restrictions with some clients and they may have to go that route. We just want to make sure that they know that there's that reduced coverage on the 50/50 plan. Another thing to point out, going to the next slide, we do have guaranteed issue plans. Keep in mind that our guaranteed issue plans, even though there's no health questions, they still have the same 12-month pre-X clause that our regular plans do. So just because somebody is diabetic, they can get one of these plans, but it doesn't mean it's going to cover their diabetic needs from day one. There's still that pre-X. But worst case scenario, there are people who can't qualify for a plan and they want to make sure they have something in case they get sick and land in the hospital or they break their arm and need treatment. The guaranteed plans will cover something that's new health-wise, a a health diagnosis or broken bones or an accident, it will cover that. Just keep in mind that the coverage maximum on those is $100,000, but it beats not having any insurance whatsoever. So keep that in mind. We do have the guaranteed issue plans available. I want to go down and talk about our Life Association membership. Some of you who have run quotes or have done enrollments before, you'll notice that when billing time comes, it's broken apart, and there's a $15 charge that goes towards our Life Association fee. And you're going to ask, what is it? Why is it? Your clients are going to ask about it. Now, it's all in the quote itself. So it's not added on top. So anything that you're working as far as quote with your client, it's all built into those costs. But they're going to say, why do I have to have this? Well, number one, that's how we file our plans with the state. But what do they get out of that? The first key piece is that telemedicine benefit that we were talking about. So that $15 a month gets you the unlimited telemedicine. This is a real short notation of things that are built in here. Auto services like roadside assistance, identity theft programs, and then there's discounts for a ton of things, whether you're buying a car or you're buying tires or wheels or you're looking for a gym membership, retail stores, going out to eat. There's a 70-page booklet on benefits and savings that you get within this Life Association. But we want to make sure that our clients know what it is, that's what the $15 is paying for. The key piece is that telemedicine benefit and our prescription discount card that they can register for. So just keep that in mind. There's a ton of benefits that are built in there. We just want to make sure that everybody is aware of it. So I want to go back to the quoting site itself. And when we were at this details page, another thing that I did forget to mention, this is the link to click on for the brochure itself. This provider directory, that will take you to Aetna's website, and then you can start looking for doctors, hospitals, urgent cares, other facilities within the Open Choice PPO network. Because I know that there's a lot of clients who want to know what hospitals are available in my area. Can I go to see my current doctor or, our pediatrician for our kids? That provider directory will take you directly to their website, and you can start doing those searches. So this is all at your fingertips whenever you're into our quoting site itself. But I'm going to go back to the quoting site, and just for the heck of it, let's just take probably our most common short-term medical plan, the 5080-20. Another key piece before I add this to our shopping cart is this max out-of-pocket. These figures that are listed here include the deductible. So when you're looking at a $5,000 deductible and it says max out-of-pocket is $10,000, this $5,000 is already included. So your co-insurance maximum is $5,000 on top of the $5,000 deductible. So it's not in addition to the deductible. We get that question asked a lot. Just want to make sure that everybody's on the same page, that max out-of-pocket includes the deductible, whatever it may be. And you'll notice here too, if you look at the $5,000 deductible with 100% coinsurance, that means your max out-of-pocket is only your deductible. But I'm going to plug in this plan to our shopping cart, and it gives us a couple different options. Do we want to enroll the client right now, which means you're going to take care of the application, and once that's done, we send an email for verification to your client. We need them to register. Obviously, they need to access their ID cards, access their documents, but we also need them to complete an electronic signature. Now, we really want to get into a habit of the clients doing the electronic signature, because as of the new year, we won't even issue policies unless the client has completed their verification. So we definitely need to get in the habit of doing that, making sure that they can access their documents, their ID cards, they're doing their signature. Another thing too, if you create a proposal, this means you're sending your quote to the client. Well, that gives them the opportunity to look at what you've put into the shopping cart, because you can add multiple short-term plans to the shopping cart. And that gives them an opportunity to shop around. Maybe they want to go with the 100% plan versus the 80-20. But whatever you put in the shopping cart, you can hit this create proposal, and then you can email whatever was in the shopping cart to them, and then they can complete their application. They can complete their electronic signature all at once. So you can put together a number of things that they can view. But like I said, you can also do the enroll now, where if you're on the phone with them and they're committed to what you, being the expert, is telling them to go with, a lot of times that's the easier route, because then you don't put it in the client's hands where it gets busy and they may forget to complete their application because you talk to them on the lunch break or when they've got to run after work with their kids back and forth. So that might be easier. I did want to look at a couple of our supplemental plans, because you're going to have access to these and you've got different tabs across the top. These supplemental plans can be sold on a standalone basis. So you can sell a dental plan to somebody who is on an ACA plan or has a policy through their employer. These can be done standalone, or they can be bundled within the shopping cart with our short-term medical plans. One key piece, and I want to point this out because it's the best thing that we've had moving for our policies as far as supplemental plans go, is something that's labeled as our plan enhancer. Our plan enhancer, if you guys worked with us when we used to be Assurant Health, was an accident medical expense plan, and it still is. But you can enhance that accident plan because you can add a few different riders. There's one that says CHS, and that stands for cancer, heart attack, and stroke. Now, I know at the very beginning I mentioned our SIP rider, which you'll be able to find throughout these plans. The cancer, heart, stroke, and the SIP rider will pay out the full benefit that the client has enrolled in. So cancer, heart attack, and stroke, it's just that. If they're diagnosed with one of those symptoms, we're going to pay out their benefit amount, no deductible, here's your money. It doesn't matter if they've already fulfilled their deductible for the year. Same thing goes with this SIP rider, or the sickness inpatient. They spend one day in the hospital, or one night in the hospital, I should say, because of pneumonia, appendicitis, the flu. We're going to give them their benefit amount, and it pays directly to the client. They can do whatever they need. The accident plan, just as it worked when we were Assurant Health, it will cover the out-of-pocket expenses incurred due to an accident up to their benefit amount. One thing to keep in mind, and it states here, there is a $250 deductible per accident. The cancer, heart, stroke benefit, the sickness inpatient benefit, is a lump sum payout to the client. There's no deductible there. But you're going to notice that there are quite a few choices, because what you really want to do is take the dollar amount or the benefit amount, and you want to match it up with your client's deductible or their max out of pocket to try and make them whole in a worst case scenario. But you're going to see that there's a lot of different benefits, because you can go up to $10,000 just as an accident plan, or you can build in the different riders, the cancer, heart, stroke, or the sickness inpatient rider. And I even have the plan for myself and my wife. It's just so much easier to build this small cost into your budget on a month-by-month basis and make sure if there's a slip and fall or there's a broken arm. Or I had an agent call last week, and his daughter had her wrist broken during a volleyball tournament, and this is going to take care of all their out-of-pocket expenses. So you definitely want to look at that. Like I said, there's a lot of options within the plan enhancer. The other thing that we do have is our TrioMed plan. They're both really good plans. The TrioMed plan doesn't give you as much versatility, because it is a package deal of critical illness, accident coverage, and accidental death and dismemberment. So you can look at it, face value, $5,000 critical illness, $5,000 accident coverage. So it's always a prepackaged deal. You've got a little bit more flexibility within the plan enhancer itself. The one thing to point out is that if you do bundle the TrioMed with our short-term medical plans, when you're going through the application process, it will give you an $11 discount on TrioMed. So by all means, it's a great plan. Coverage for accidents, coverage for critical illness like the cancer, the heart attack, the stroke. The only piece that we can't build in to this like we have for plan enhancer is that sickness inpatient rider, where, like I said, it's hospitalization for one day to the flu, pneumonia, and it'll take care of it from that angle. So by all means, they're great plans to have as far as backup coverage, something to take care of their deductible, take care of your client's out-of-pocket expenses. But it's something else that you build into the shopping cart. And this is where you do your online shopping. You look at our different tabs. You put the different plans into the shopping cart. If your client's good with what you're giving to them, you can do the enrollment. If they want to take a better look at it, or they want to look at a few different options and the benefits and the brochures, that's where you're going to create the proposal and you're going to email that specific report to your client. But there's a lot of versatility within our plans as bundled packages, as standalone plans. But the key piece is the laws are changing. We're going to the 12-month plans as of October 2nd. There's going to be a few states that throw roadblocks at us, and they may limit the plans to 6 months at a time. I know right now a state like Indiana, they're going to limit to 6 months. But what we'll do in Indiana, and we just had meetings on this earlier this week, is that Indiana will do a 2x6. So we'll do 2 consecutive 6-month policies, so we're still going to have a 12-month story in those states. But I know the majority of the business for you guys that are working with us is going to come from Texas, and we're going to be able to run those 12-month plans, or technically 364 days. So, like I said, if you're not currently contracted with us, please get in touch with Belinda or whoever may be sending out those links. If you're going through our quoting site, or you're having issues getting registered, or looking at details of our plans, or you have questions, I want to make sure that you can give me a call. Like I said, my name is John Majewski. The last name is spelled Majewski. Again, that was Majewski. And my direct number is 414-604-5473. 414-604-5473. And generally Monday through Friday, I'm going to be available. That's my direct number. So if you don't get me, you're going to get my voicemail. And let's see if we have a couple of questions here. All right. So there was a question about one-time pay on our short-term medical plan. So if we do a single pay 89 days or less, we do give a 5% discount. Like I said, we don't have a lot of people who can really afford the 89 days worth of premium, so most people are doing the month-to-month scenarios. Non-network, here's a key piece, is we call this a passive network plan. You can use the Aetna Open Choice PPO network for the network discounts. If you go to somebody who's out of network, whatever the client ends up paying is still credited towards their one deductible and coinsurance. We don't have separate deductibles for in-network and out-of-network. So that is a huge feature. If somebody says, it's a particular doctor I have to go to and I want to go to them, but they're not in the network,